Hi, Paul Sakis, Good News Planet, Good News Broadcast. We're going to talk about a serious concern and good news. We have good news here. Bringing awareness to a rare condition, Graft, G-R-A-F-T, versus host, H-O-S-T disease. GVHD Day is February 17th, okay? So, all righty. What are we talking about here? Please.
Well, graft-versus-host disease is a medical condition that occurs after bone marrow or stem cell transplant from a donor into a recipient. When we do one of these transplants, what we're really doing is we're transplanting an immune system from that donor into the recipient. And it's the immune system's job to seek out things that it views as foreign or not belonging to itself and to reject them. And so we find ourselves in a situation with a new immune system that's transplanted from a donor in a body that it does not belong to. And so that donor immune system, that graft, tries to reject the host that it finds itself in. And the condition manifests as inflammation in a variety of organs in the recipient. So be it the skin, the mouth, the eye, the liver. Patients get red rashes, inflammation in their mouth or their eyes, and it can be very serious. It does come in a variety of severities, from mild, moderate to severe, but it can be something that can be lifelong and can affect patients for many, many years.
I have to go backwards a little bit to see if I understand what you're saying, if you don't mind, since I'm not a doctor.
Of course.
And I'm going to start with the first couple words that you said. I believe you said what we're talking about here is once there has been a stem cell from the bone marrow and it goes into someone's body. Let's stop there for a second. So that's good? That's bad? Is it good to do stem cell from bone marrow? Let's start with...
So stem cell transplant is a therapeutic modality, a treatment that we use to treat a number of diseases such as leukemias or lymphomas or other disorders of the bone marrow. In stem cell transplant, the recipient has a diseased bone marrow and it needs to be replaced with a healthy bone marrow or healthy stem cells from the recipient. The stem cells that we transplant grow in the recipient's body and they regenerate the recipient's immune system, their blood-forming organs, so they remake new blood from the donor, and that's what a stem cell transplant is really all about.
So, I'm sorry once again. So that we don't know, because everybody is different and can react differently. We don't know when we do this stem cell. I've been doing stem cell stories a long time. All right, maybe 15, 20 years, a long time. Been people, because my mom had Parkinson, and everybody suggested Parkinson, stem cells, maybe this is the solution. But in those days of old, they said, I talked to the head of the Parkinson Association, and they said, I don't know. But in any case, so you can't really tell when you do this. And that's why what you have created, or what we're going to maybe talk about here, is for those that it's not working, 1, 2, 3. Am I wrong? Right. And that the stem cell transplant works. It either works, or if it doesn't work, what you're going to talk about is something where you can help for it to work. Is this wrong? Am I wrong?
Well, no. So the stem cell transplant has in general worked if we've managed to replace the recipient's immune system with the donor's. In some respects, it's working too well, because that healthy new immune system that we've put into the recipient is recognizing the recipient's body as foreign and trying to reject it. If you think about the scenario where you do a kidney transplant, when your body sees that kidney that's been transplanted in, it recognizes it as foreign. It tries to reject it. That's what the immune system is supposed to do. But because we're transplanting a new immune system in, that immune system recognizes everything around it as foreign and tries to reject the recipient. But I want to make the distinction here that stem cell transplantation is a very well recognized therapeutic treatment for many diseases like leukemia, lymphoma, inborn errors of metabolism or genetic immunodeficiencies, there are about 10,000 transplants that are performed across the country annually in the United States.
Okay, as far as I'm concerned, that's a miracle. So the understanding of the stem cell, people freeze their placentas, don't they? Because I think there's some stem cells in there. All this
Yeah,
is, go on, sorry.
No, that is a place where we can get stem cells from the umbilical cord. That's correct.
Do you think that everybody should do that?
No, I actually don't think everybody should do that.
Okay. Well, all right, we'll get to what we're talking.
Our major source of stem cell donors are volunteer adults who volunteer to donate to other individuals.
Interesting. Okay. All right. So tell us about, I'm sorry, I didn't speak with you yet. your name is
I'm Meredith.
Hello, Meredith. So tell me about,
Hi.
I'm so sorry. I was
No,
confused.
no.
I wanted to make sure I understood this. So tell me about you,
Oh,
Meredith.
absolutely. Sure. Yeah. So it makes perfect sense that you got to understand it. So it started for me when I was 19. As Dr. Cutler said, bone marrow transplants are used to treat leukemia, lymphomas. So I developed leukemia. And so then my doctor decided that, the best thing for me was to have a bone marrow transplant. And so I had the transplant, and it has put the leukemia in remission, essentially cured it. But then after that, I developed acute graft-versus-host disease and chronic graft-versus-host disease later on. So I've been living with this for a little bit over 20 years. So it's affected my body in a bunch of different ways. So it started out as a rash, and then I've developed it in my eyes, in my mouth, my stomach, my kidneys, and my lungs and musculoskeletal system. So it's really a globally impactful illness that people experience. And, I think one of the things that's really important for people to think about is gathering information and resources when they have this illness. And one of the greatest places that they can go to for this is the GVHD Alliance website, which is gvhdalliance.org. There are resources for signs and symptoms. There are resources for caregivers and community health providers. And so you just want to say thank you so much for allowing us to talk about this.
I appreciate
this very
it, Dr.
important
Cutler,
issue.
just so everybody knows, Medical Director, Stem Cell Transplant Program, Dana-Farber Cancer Institute, and Vice President, American Society of Transplantation. Meredith is also the Patient Advocacy Director on your own foundation. Thanks, guys. Appreciate this information.
Thank you.
Bye-bye.
Thank you so much.
Bye.
We did it.